Imagine closing your eyes and going to sleep without ever waking up. One of life's few certainties, along with taxes, is death. It's unsettling to consider the thought of leaving this life when you're sleeping. This is generally thought to be the best course of action. Even though it may appear better to some, it is not particularly reassuring when it occurs to young people. In this video, we'll examine what it really means to die while we sleep and how it actually occurs. Stay tuned as we delve into the causes of sleep-related deaths. On our list, heart attacks are first. According to research, a significant number of heart attacks cause people to die while they are sleeping. A heart attack happens when the blood supply to the heart is significantly reduced or stopped. The majority of the time, the accumulation of fat, cholesterol, and other chemicals in the heart's arteries causes blood flow to become obstructed. Most heart attacks are brought on by coronary artery disease. Plaques, which are cholesterol deposits, are typically to blame for coronary artery disease, which occurs when one or more arteries obstruct the blood supply to the heart. Plaques may cause artery narrowing, which would stop the heart's blood supply. Arrhythmias come in second place. Arrhythmias, a frequent reason for passing away while you're asleep, are connected to the electrical activity of the heart. Heart failure and death are brought on by cardiac blockages that alter the electrical pattern. The failure of the heart to beat has frequently been cited as the cause of sudden, unexpected death while sleeping. The heart beats either too fast or slowly as a result of improper signals. Since these damage to the cardiac muscle as a result of abnormalities, there could be a disruption in the charge necessary for the muscle to fire in unison. Cardiac arrest can result from the heart's ability to pump blood efficiently becoming impaired, irregular, too rapid, or too sluggish. Another frequent symptom is strokes. Strokes frequently happen when you're sleeping, which can cause an unexpected death. The heart has a big impact on other systems that need blood capacity for circulation. Specifically, an irregular heartbeat might cause a blood clot to migrate to stroke in the brain by damaging it. People with these characteristics and symptoms are more likely to pass away in their sleep because hypertension, or high blood pressure, may increase the risk to a higher level. Additionally, congestive heart failure contributes to abrupt demise. Total heart failure may eventually follow congestive heart failure. Rapid right-sided heart damage from left-sided heart failure can lead to fluid buildup in the lungs, shortness of breath, especially while sitting down, and peripheral edema in the feet and legs. The heart's ability to pump blood can stop if it is overloaded. The person becomes brain dead and goes away in their sleep when the heart stops pumping blood. In other cases, the affected person might have had a hidden cardiac condition that increased their risk of passing away from an irregular heartbeat. Heart disease can kill both young and old people. The most common cause of mortality among young athletes, according to the American Academy of Pediatrics, is sudden cardiac death while sleeping or during the day. As a team, the heart and lungs function together, and if one system fails suddenly, the other is likely to follow shortly after. Let's investigate pulmonary illness. The symptoms of pulmonary disease might take time to manifest and are frequently chronic. Death may come from this disease's progression. The lungs are responsible for taking oxygen and carbon dioxide from the air at the most fundamental level. Your body's acid-base balance can shift significantly when the lungs aren't working properly, causing blood oxygen levels to drop and carbon dioxide levels to rise. When there is a sudden obstruction, such as when someone chokes on vomit, asphyxiation may occur. Even though it's unusual, obstructive sleep apnea patients could pass away. Respiratory failure can be brought on by persistent diseases such as chronic obstructive pulmonary disease, cystic fibrosis, emphysema, lung tumors, and pneumonia that worsen over time. The lung's own failure to function results in respiratory failure. The lungs can also stop working due to conditions that affect the muscles or neurological system, such as amyotrophic lateral sclerosis or myasthenia gravis. Breathing difficulties can occasionally result from congenital conditions like congenital central hypoventilation syndrome. When babies don't breathe properly while they sleep, it can sometimes result in SIDS, which stands for sudden infant death syndrome. Sleep fatalities sometimes involve sleep apnea. Obstructive sleep apnea is one of the worst common causes of the many various types of sleep apnea. Our sleep habits are mostly impacted by obstructive sleep apnea. It causes your breathing to stop and resume repeatedly while you sleep, which causes your neck muscles to occasionally relax during the night and clog your airways. Untreated sleep apnea, according to researchers, increases the risk of having a heart attack. Untreated sleep apnea patients have a doubled risk of having a stroke. Obstructive sleep apnea kills. Then, how? The amount of oxygen in the blood may suddenly drop if the respiratory system's air channel gets blocked. Obstructive sleep apnea increases the chance of abrupt cardiac arrest or a brain attack, which can result in an untimely death while a person is sleeping if they are already at risk for heart attack and stroke. Between midnight and 6 in the morning, patients with obstructive sleep apnea are more likely to experience sudden cardiac death. According to data, Around 22 million Americans suffer from sleep apnea, and about 80% of these instances go undiagnosed. Silent killer: carbon monoxide poisoning. In cars, fireplaces, gas stoves, grills, and furnaces, carbon monoxide is a colorless, odorless gas that results from the burning of fuel. Insufficient ventilation in enclosed places can lead to carbon monoxide poisoning. The symptoms of carbon monoxide poisoning range from headache, dizziness, and fatigue to nausea, unconsciousness, and sudden death. Installing a carbon monoxide detector and doing regular tests is the best way to find carbon monoxide in your house. The CDC estimates that 400 persons a year in the United States alone pass away from carbon monoxide poisoning. Epilepsy is last but not least on our list. Epilepsy significantly raises the danger of passing away while you sleep. According to the Epilepsy Foundation, more than 1 in 1,000 epileptics pass away suddenly each year. The probability that someone with epilepsy would die suddenly and unexpectedly while they are asleep can be reduced if they are able to adequately control their condition with appropriate medication. It appears that we have covered the main reasons why people pass away while they are asleep. Hopefully, you've learned that, along with a few other factors, your heart and brain health have the biggest impact on your chance of dying while you're asleep. It can be thought that once your time has come, there is nothing you can do to change it. We frequently disregard symptoms of ill health, especially those that affect our hearts. Let's continue the discussion with a few more heart-related films. Shall we?